Imagine waking up one morning and realizing your vision is blurry. Then, over time, it gets worse until the whole world around you fades completely away. Scary, right? That's the silent danger of glaucoma, a disease that gradually steals sight without warning. But don't fret just yet. Stay with us until the end while we look into 10 common mistakes that could be putting you at risk of developing glaucoma. Number 1. Skipping eye exams. Alright, this one might seem a bit obvious, but can you even remember the last time you went for an eye exam? It's one of those things we know we should do, like flossing or rotating our tires, but we don't until we notice a problem. Regular eye exams are non-negotiable, especially for glaucoma. Glaucoma is sneaky, often developing without symptoms. Eye exams detect subtle changes early when treatment is most effective. So, do yourself a favor and schedule that appointment. Your future self and your grandchildren will thank you. Number 2. Ignoring family history. Let's talk family history because when it comes to glaucoma, those genes don't fall far from the optic nerve. If a family member's struggled with this disease, you better pay attention. This means your risk just went way up, significantly higher than someone with a clean eye history. But why's that? Well, glaucoma isn't just something that happens randomly. It can also run in families. If you have a close relative, like a parent or sibling, with glaucoma, your risk of developing it is much higher. This is because certain types of glaucoma, especially primary open-angle glaucoma, have a strong genetic link. Researchers have even identified specific genes associated with the disease, meaning some people are simply more predisposed to developing it. Catching glaucoma early on can make all the difference in preserving your sight. So share this important information with your eye doctor. Now let's talk about blood pressure. High blood pressure and glaucoma are more connected than most people realize. When blood pressure is too high, it can affect the tiny blood vessels in the eyes, potentially leading to poor circulation and damage to the optic nerve. Some studies suggest that fluctuating or consistently high blood pressure may contribute to increased eye pressure, a key risk factor for glaucoma. On the flip side, if blood pressure drops too low, especially at night, it can reduce blood flow to the optic nerve, also increasing the risk of damage. This complex relationship means that managing blood pressure isn't just about heart health. It's also essential for protecting your vision, especially if you have a genetic risk for glaucoma. So how can you help that? Well, eating a healthy diet, exercising regularly, and taking your prescribed medications can all assist in keeping your blood pressure in check and your eyes happy. Number 4. Eye drops. Okay, let's talk about eye drops now, those tiny bottles of liquid gold that promise to soothe, brighten, and generally improve your ocular situation. But here's the thing about eye drops, specifically the prescription kind. They only work if you actually use them. I know, it's tempting to skip a dose here and there. Life gets busy, you forget. But when it comes to glaucoma, consistency is key. Those little drops are like the bouncers of your eyes, keeping that persistent eye pressure in check and preventing further damage. So, do yourself a favor and make those eye drops a non-negotiable part of your daily routine. Number 5. Smoking. We all know it's bad for us, like really bad. But what you may not know is that smoking isn't just bad for your lungs. It's like a wrecking ball for your entire body, including your precious eyesight. Smoking damages blood vessels, increases inflammation, and generally makes it harder for your body to function properly. Kicking the habit is one of the best things you can do for your overall health, including your eye health. It's like hitting the reset button on your body, giving it a chance to heal and regenerate, so if you needed an extra push to stop your cigarette addiction, here it is. Now let's talk about food. Diet plays a bigger role in eye health than most people think, and it can directly impact glaucoma risk and progression. Foods rich in antioxidants like leafy greens, berries, and fish high in omega-3s help protect the optic nerve from damage by reducing inflammation and improving blood circulation. On the other hand, a diet high in processed foods, sugar, and unhealthy fats may contribute to higher eye pressure and oxidative stress, both of which are linked to glaucoma. Staying hydrated and maintaining a balanced diet with plenty of vitamins A, C, and E, along with magnesium, can help keep your eyes in top shape and potentially slow down glaucoma progression. Number 7. Caffeine. All right, coffee lovers, tea enthusiasts, and anyone who relies on a little caffeine boost to get through the day, this one's for you. We need to talk about everyone's favorite stimulant and its potential impact on our eyes. A moderate amount of caffeine is generally considered safe for most people, including those at risk for glaucoma. However, excessive caffeine intake has been linked to a temporary increase in eye pressure, If you're noticing any changes in your vision or experiencing eye discomfort after your daily caffeine fix, it's a good idea to talk to your doctor. They can help you determine if your caffeine intake is something to be concerned about and suggest ways to adjust your habits if necessary. Number 8. Lack of eye protection. All right, folks, let's talk about eye protection. Eye injuries can increase your risk of developing glaucoma down the line. Whether you're playing sports, working with power tools, or just doing some yard work, wearing appropriate eye protection is crucial. Those safety glasses, goggles, or even just a good pair of wraparound sunglasses can be the difference between a near miss and a lifetime of vision problems. So don't hesitate to wear them. Number 9. Self-medicating. Okay, folks, let's talk about something we've all been guilty of at some point: self-medicating. But here's the thing about self-medicating, especially when it comes to our eyes. It's a terrible idea. Your eyes are delicate, complex organs, and messing around with them without proper medical guidance is like performing surgery on yourself with a rusty spork. Those over-the-counter eye drops might seem harmless, but they can interact with other medications you're taking, mask underlying conditions, or even worsen your symptoms. And when it comes to glaucoma, which often requires prescription eye drops to manage eye pressure, self-medicating can have serious consequences. Schedule an appointment with your doctor or an eye care professional. Number 10. Misusing contact lenses. Misusing contact lenses can significantly increase the risk of developing glaucoma, especially when they are worn for extended periods, not cleaned properly, or not replaced as recommended. Overwearing lenses can lead to reduced oxygen flow to the cornea, increasing eye pressure, which is a key factor in glaucoma development. Additionally, poor hygiene or using expired solutions can cause infections or inflammation, which may worsen eye pressure or cause damage to the optic nerve over time. Not taking proper care of contact lenses can also increase the risk of other eye conditions like dry eyes, which further exacerbates the potential for glaucoma. Regular eye exams are essential for those who wear contacts to monitor eye health and prevent complications. So that's it. We hope you enjoyed this video. Thank you for watching. If you notice any differences in your eyesight, look for a doctor immediately. Don't forget to like, share, and subscribe for more health tips and curiosities. See you all next time.